I'm making this video for a friend of mine who suffers from carpal tunnel syndrome. Carpal tunnel syndrome is something I've treated successfully since, around 1990. I have been a licensed chiropractor since 1989, certified to do acupuncture since 1991, I think. I graduated medical school with an MD in 2006 and then was in family medicine residency at Louisiana State University in 2007. Carpal tunnel is something that I have found fairly easy to fix, and I'm going to give one of the main pillars of treating carpal tunnel syndrome. If you don't mind, I'd like to discuss carpal tunnel just for a minute. As someone who has graduated both from medical school and chiropractic school and practiced both as a chiropractor and a medical doctor, I find strengths in both systems, but neither one really corners the market in how to do things. When it comes to treating carpal tunnel, I feel like most medical doctors really miss the boat. When I started practicing as a chiropractor in 1989, the most common workers' compensation injury was low back injuries from lifting and twisting simultaneously. I never could foresee a day that carpal tunnel was the most common workers' comp injury, or one of the most common. If someone told me that someone sitting and clicking a mouse all day just like this would result in disability, I wouldn't have believed them in 1989. However, soon after the invention of Windows and people using a mouse to work a computer, it became one of the most common workers' compensation injuries. It comes from repetitively flexing the fingers. This little motion, flexion. Here is a study that was published in the Archives of Physical Medicine and Rehabilitation. Carpal tunnel syndrome, the contribution of flexor tendons. There are 9 flexor tendons in the carpal tunnel. There's my wrist. These carpal bones form a tunnel just like that, and 3 nerves go through there: radial, medial, and ulnar. Constantly flexing the fingers and the wrist cause the nerves in that tunnel to get entrapped and for the tendons going through that tunnel to get inflamed and swollen, and they can put pressure on those nerves. In this case, we're most interested in just specific nerves. In this study from the Journal of Orthopedic Research, median nerve deformation and displacement in the carpal tunnel during index finger and thumb motion. And they're talking specifically that they find displacement of the median nerve with flexion of these fingers and not extension. The fingers going this way is flexion, that's extension. The wrist going this way is flexion, that's extension. They have found flexion is what causes the problems. Again, taking a mouse and just clicking it, flexing the finger, is the main cause of carpal tunnel syndrome. In this article on carpal tunnel diagnosis, they mention a test called Phelan test, in which the patient forcibly flexes their wrist, and it causes a reproduction of the tingling and pain and numbness. No shit. In this thing I just whooped up on Google, due to entrapment of the median nerve in the carpal tunnel, people experience tingling, numbness, and pain. These symptoms are exacerbated or made worse in the extreme wrist flexion position. Again, no shit, Sherlock. Flexing the wrist and the fingers is what causes it. That's what's going to exacerbate it. Balance is the key. Doing the opposite motion will improve the symptoms. Flexing the wrist and flexing the fingers causes it and exacerbates it. So to do this, to help fix your carpal tunnel, you're going to need a rubber band. You'll put the rubber band around your fingers when they're in what I call the duck beak formation. You'll put your wrist on a table and extend your wrist, and then extend your fingers, doing the opposite motion that causes it. Just seems like common sense. I was doing this and other chiropractors were doing this 30, 40 years ago and curing carpal tunnel. Do this. I usually recommend a patient do it about 50 times a day, starting 3 times a week. And as long as it doesn't aggravate anything, start doing it more daily. Along with this, I would tend to do acupuncture, if you want to sound sophisticated, and adjust the wrist, the elbow, the shoulder, and the neck as a chiropractor. And I can't think of a condition that wasn't improved or fixed by doing these. There may have been one over the last 40 years of me being a chiropractor treating this, but I can't think of it offhand. This is the motion with the wrist in extension. So we're doing the opposite. Flexing the fingers, flexing the wrist cause it. So we're going to extend the wrist and extend the fingers against resistance. If you can tolerate it, you can work up to 200 a day. I've seen people who just doing this exercise have eliminated their carpal tunnel. It opens up the tunnel and it strengthens the muscles and the tendons that oppose flexion. It helps create balance in the wrist. It may take some time. Try this, and as long as it doesn't aggravate your wrist, continue with it and increase the number of days you do it and the number of times you do it. And I believe you'll find improvement in your carpal tunnel without surgery.